today we're going to go through a case study of a client that came into clinic this week with some Achilles pain. So they had recently picked up running. They'd gone from never running before to try and build up to between a 5 and 10K with no slow process to get into that. This has then meant that we've got a massive load of pain in that Achilles area, so around the back of that ankle, and now we're struggling to kind of walk and run. From our assessment, we found we had quite a bit of sensitization through that calf into the Achilles, and they were actually quite weak through this right side. The other thing that we found is we were quite stiff through the front of the ankle just along here, so we're going to try and work on that as well. So we'll start with some isometrics. So all we're going to do is we're going to push up on both of those feet, good, up into a calf raise, and we're just going to hold. We're going to aim to squeeze through the calf here, nice and tight. Try and make sure that we're pushing through that big toe so we stay nice and even. The other element that we found was that we were quite stiff coming across the front of the joint line here. So the bone that sits underneath here is called your talus. When we have any kind of Achilles problems, sometimes this area can get really quite stiff. So what we want to do is work on mobilizing through here just to loosen that joint, and then it stops some of that referral pain that comes around to the back of the Achilles. So if we pop this band around the ankle here, what we're going to do is take a big step forward with that leg. That's it, so we've got a nice amount of resistance. And as we drive this knee across, this band is just encouraging that talus to just slip back a little bit and allow for a little bit more room in that ankle. And actually this should feel a lot more comfortable through the Achilles compared to when we've done this up against the wall without it.